To identify common heart conditions, you'll need to have some tests. These could include blood pressure tests, checking your pulse, X-rays, ECG, stress tests, laboratory test. Hi, my name is Enurita James. I am a clinical research scientist working and living in Germany. I am passionate about preventive health. Welcome to my channel. Checking your pulse. Taking a pulse is a very important part of heart health checks. It measures the number of heartbeats per minute, assesses if the pulse is regular or not, and identifies the strength of the pulse. Your nurse or doctor may check your pulse, or you can check it yourself. Blood pressure. Blood pressure is an important measurement that can be taken by your doctor, nurse or healthcare assistant. It's recorded as two readings. Systolic pressure, higher reading. This records the pressure within the blood vessels as the heart contracts and forces blood out into the arteries. Diastolic pressure, lower reading. This records the pressure when the heart fills up with blood again. Your blood pressure fluctuates throughout the day, depending on what you're doing. The white coat effect is when your blood pressure rises at the thought of having your blood pressure taken. To prevent this, when you get your BP taken, try to relax. You might be asked to sit quietly for at least 5 minutes beforehand. Tell the person taking your blood pressure about any prescribed medicines you're taking. Sometimes your doctor may want you to monitor your blood pressure at home over a period of time. This can be either by 24-hour ambulatory monitoring or by home monitoring. Read more from the British Hypertension Society on home blood pressure testing. British Heart Foundation have information on measuring your blood pressure at home. Echocardiogram. An echocardiogram, or echo, is an ultrasound scan of the heart. It uses high-frequency sound waves to create an image of your heart. This is a painless procedure that is usually performed in hospital or in an outpatient clinic. You'll have jelly applied to your bare chest, and an experienced operator will move the probe around your chest to get good views of your heart. It can check the size of your heart, how well the heart muscle is contracting and relaxing, how well the valves are working. Electrocardiogram. An electrocardiogram, ECG, is a test that records the electrical activity of the heart. The ECG reflects what's happening in different areas of the heart and helps identify any problems with the rhythm or rate of your heart. The ECG is painless and takes around 5–10 minutes to perform. 24-hour or ambulatory electrocardiogram. In this test, electrodes are connected to a small box and attached to a belt. You wear this belt for 24 hours, as you go about your normal daily activities. The ECG will be monitoring and will be able to record any abnormalities over the day. You'll also be asked to record any symptoms. Then this can be assessed by the electrophysiologist or cardiologist. Stress test. This stress test, or exercise tolerance test, ETT, or treadmill test, is similar to an ECG but records the activity of the heart as it works harder, for example while you're walking on a treadmill. This exercise, ECG, records how the heart responds to exercise. Tilt test. A tilt test allows the doctor to monitor your blood pressure and heart rate when you're lying down and standing up. This test is designed to assess symptoms you may have been experiencing, like lightheadedness or dizziness, and to see if your symptoms are related to your blood pressure or heart rate. The test will normally be done as an outpatient appointment in an electrophysiology department. Let MSEPAUSE and give a little information that might interest you. Every boy loves good health, everybody loves money. How about finding out how you can get both? Sounds interesting? Click link below to start your online business selling supplements. You will not only help people live better lives, you will also make money in the process. Now let's continue with the video. Magnetic resonance imaging, MRI. This painless scan uses a magnetic field inside a scanning machine to produce images of the heart and blood vessels. It's useful for checking problems with structure of heart and blood supply. It's very helpful in getting images from people whose vessels and heart anatomy are difficult to see using angiography. Thallium scan, myocardial perfusion scintigraphy. This scan shows how well blood is reaching the heart muscle through your coronary arteries. A small amount of thallium, radioactive substance, is injected into a vein, and a special camera moves around your heart. The camera picks up traces of thallium and produces pictures. As thallium doesn't travel well to areas where there's a poor blood supply, the pictures can be used to see how well blood is reaching your heart. It's a useful alternative to an exercise test if this can't be done or when specific information on your heart muscle is needed which a treadmill exercise test can't provide. This is done at rest and during exercise. The very low levels of radiation used are considered to be safe. Coronary angiogram. A coronary angiogram is a type of X-ray used to examine the coronary arteries supplying blood to your heart muscle. It's considered to be the best method of diagnosing coronary artery disease, conditions that affect the arteries surrounding the heart. During the test, a long, flexible tube called a catheter will be inserted into a blood vessel in either your groin or arm. The tip of the catheter will then be fed up to your heart and coronary arteries. Special dye will then be injected through the fine catheter into your coronary arteries, and X-ray images will be taken. These images created during angiography are called angiograms. These images will be used to identify narrowing or blockage of the arteries that may be responsible for your symptoms. This test is also sometimes required to reach a diagnosis for patients with heart valve and muscle disease. If you are enjoying the video, remember to subscribe and hit the notification bell. Laboratory blood tests. There are a number of blood tests that can be done to rule out other causes of heart symptoms, and to measure different levels within the body that can affect the heart. You may also get blood tests done if you begin a new heart medicine. The most common are full blood count, FBC. This test measures the levels of red blood cells, white blood cells and platelets. It also measures the hemoglobin, oxygen-carrying component of red blood cells. Urea and electrolytes, US and S. Urea levels help to monitor how the kidneys are working. Electrolytes help to stabilize the heart rhythm. Troponin blood test. Troponin is a protein which is released into the bloodstream when the heart muscle is damaged. The troponin level provides a quick and accurate measure of any heart muscle damage. It's used to help in the assessment following suspected heart attack. It may be taken on admission to hospital and/or 12 hours from the onset of symptoms. Cholesterol level and lipid profile. Natriuretic peptides, an indicator of heart failure. Creatinine kinase, a CK test, is mainly used to help diagnose and monitor injuries and diseases that damage skeletal muscles and cause high levels of CK in your blood. But it may also be used for conditions that damage the heart muscle and the brain. Chest X-ray. A chest X-ray is useful for showing the size and shape of the heart and detecting chest disorders. This can provide doctors additional information about your symptoms, which can often relate to both chest and heart conditions, and can also show any fluid in the lungs, which may be caused by heart disease. Thank you for watching to the end. Remember, good health is not an event, it's a lifestyle. Please share the video to your friends so they can be informed.